So another question I get, which is actually very common, in fact, I not only face this from parents, people ask me at social events and at family gatherings, is that this vaccine is really new. So how do we know that it's safe? What is its kind of safety profile? How is it developed so quickly? Can we really trust it? I think one thing to recognize is that, first of all, how is it developed so quickly? There's 2 or 3 bottlenecks to vaccine development. One is identifying the organism. So in the past, for example, to identify polio or malaria or any sort of, or Ebola, for example, would take some time. With coronavirus, if people remember SARS, MERS, these viruses, those are coronaviruses. So those are essentially early precursors to COVID. So we had already been studying this. Coronaviruses have been studied for 50 years. It only took 10 days to sequence the DNA of COVID. So that obviously saved time. The second bottleneck that occurs is in funding and in knowledge and collaboration. Because it was such a pressing issue, instead of 1 or 2 labs in the world working on something, for example, again, to use the example of Ebola, Ebola was a very localized problem. So the reality was the rest of the world, frankly, didn't care. So what was happening is it was related to a few African countries, Europe, few places in Europe, that's it. So you've got 5 labs, for example, working on the Ebola vaccine. Over here for COVID, you've got 50 or 100 labs throughout the world working on vaccines. So you've got that momentum. The last bottleneck, so to speak, in vaccine development is usually getting volunteers. So if you need to recruit, let's say, 50,000 volunteers to trial a drug, and you're recruiting 5,000 a year, it's going to take you 10 years, right? But what happens if you have 50,000 volunteers the very first year? That's what happened with COVID. It's like, in your grandparents' day, if it took 6 hours to do laundry, now it takes 30 minutes. It doesn't mean clothes are less clean now, right? Technology advances, things will speed up. Our next vaccines will be even faster and faster, unrelated to COVID. So as far as the development profile goes, people often say that because it was fast, were there shortcuts? Were safety protocols violated? Did we skip some steps? No, actually every single step was followed just as in previous vaccines. It's just we're now able to do so much more efficiently. As far as the safety profile, like anything, of course, we know the short-term safety profile is very good, especially in kids. Just the same way that children don't develop as serious illness, they also don't develop as serious side effects. In both ways, their immune system is well suited to handle both the illness and also the vaccine for it as well. So now, what is this vaccine? Because, parents are sometimes confused by it. Are we giving them the virus? Are we giving them a part of it? What is this mRNA technology? Is this a new technology? You keep on talking about something being novel and new. It does cause a little bit of fear because, wait a minute, I don't want something that's new, like never been done before, right? I'm not going to be the first person to get into this plane that's never flown before or this device that's never, been used before. I think we have to take a step back. The concept of vaccines is a really old one. Decades, we've been a long time. The difference between this is more, I describe it like, for example, having a Tesla versus a gasoline car. Yes, a Tesla is different, it's new, but at the end of the day, it's a car, right? You still get in, you still have a gas pedal. It's not gas, but you still have a pedal, you have a brake, you have a steering wheel. It still drives the same way. You still have to watch the road for hazards. So essentially an mRNA vaccine is really like any other vaccine. From a physiologic perspective, it's doing the same thing. The only thing that's different is behind the scenes kind of how they've created it. So the way it works is, and as I talked to a little bit earlier about like SARS and MERS and whatnot, for 50 years we've known that there's a certain part of the coronavirus which the body reacts to. It's called the spike protein, and you'll sometimes hear about that. So all they've done with this vaccine is they've taken just the spike protein. That's all they've taken, so it's not the entire virus. And they've taken the code for it, the blueprint, so the DNA. So it's not even the spike protein itself. They've taken the blueprint for it, and they give that blueprint to your body. So they're injecting that blueprint into your body. What happens is your immune system takes a look at that blueprint and then develops antibodies to what that blueprint will create. So it kind of recognizes, okay, anytime we see anything that's been made by this blueprint, we're going to attack it, which is in this case the spike protein. That spike protein is common to all coronaviruses and specifically to COVID here. So after a while, that blueprint then vanishes. It sort of self-disintegrates. So then all you're left with then in your body is these cells that remember what spike protein looks like, and if they ever encounter it in the future, a week from now, 6 months from now, a year from now, we're not sure how long vaccines necessarily last, but it's at least a year or so, that they'll automatically attack the spike protein at that time. The vaccine doesn't stay in your body, the actual ingredients themselves kind of fall apart and dissipate, and nothing's left except your own natural immune response.